Hello, my name is Sean Kessler, and today I'm going to be discussing nursing philosophy. So the contents today that's going to be discussed is who am I, which is the basics of understanding who I am and why do I want to be a nurse. Next is going to be the defining nursing, which is going to be the definition and why it exists. Major domains, the vision, the challenges, and professional development. And then the conclusion, which is going to be a basic recap of myself and about nursing. So first we're going to talk about who am I. I was born in Charleston, South Carolina, December 24th, 1990. I grew up there for about 95% of my life. I graduated high school there in 2009. Shortly after, in 2011, I joined the military as a military police officer and PCS'd here the same year, and I haven't left. In 2016, I ETS'd and got out of the military, and then began working in the civil services. And then I started going to Methodist in fall of 2016. And my plan is to become a go commission back into the military as a nurse and finish out until I retire. Alright, with my family, I got a whole bunch of people that's actually in the medical field inside my family, but a few of them are going to be my grandma. She was an ultrasound tech, and she's been one since I can remember. My mother, she got her ADN in '99 and then worked as a trauma nurse for about 11 years and then got her BSN, and now she works at home. She's been a nurse since I was a child, so that's all I really see. And then her husband, my stepfather, he just graduated Yale with his PhD in nursing. Alright, and why do I want to be a nurse? Well, they're all in my family, and I kind of want to follow in my family's shoes and add another one. Alright, and the definition of nursing is going to be, well, medicaldictionary.thedictionary.com defines nursing as the application of medical and humanitarian principles by a person ancillarily the medical profession so as to maintain health and fitness, assist in recovery from mental or physical or injuries, relieve pain or distress, or ease the process of dying. Broken down, it means a medical profession that helps maintain physical and mental injuries, pain, and dying. So why was nursing created? Well, nursing has been around for a long time. And I think the reason why nursing was developed was because that you needed it like a middleman. I can think of the easiest way I can think about it is like a secretary in a way, that you are the middleman between yourself and the doctor as a nurse. So you are the first person that the patient sees. If you go to the window or if they go into the room, typically it's going to be the nurse first. You are going to be the middleman between the patient and the doctor unless the doctor has to go and talk to him. And then you pretty much assist the doctors when aid is needed. Meaning if you're working in the operating room, you help them out, or if you're working in the ER and you have to go give blood or take blood. Now, assumptions of nursing. Now, as of right now, I work as a security guard at Womack, so I see a lot of it, and some of it is they work long hours. I know, like I said, with Womack, they work usually 12-hour shifts. Which is a long time. They're overworked, it looks like. Every time something happens, they always need a nurse, and the nurses are the ones that always goes. And for you, it'll always be a culture shock because you never know what you're going to get when you go into the room. Especially with me going back active duty, I would be anywhere in the world, and depending on their religion or the type of community that lives around there is how I should act. Or at least demonstrate some sort of respect towards it. So the definitions of the domain. First, you have a person, which is they have to have knowledge, they have to have positive values, they have to have the skills, they have to be able to think critically, and they at least have to know how to talk to someone. They have to have them IPC skills. Me being prior military with military police, actually, I used a lot of these whenever I did interviews, interrogations, or even traffic stops. I would have to know knowledge of what I'm doing. I would always have to think positive that I was going to go in there to succeed. I had to have the skills to be able to do it. I had to be able to think critically by myself and fix problems that needed to be fixed. And I had to be able to talk to people. If I wasn't able to talk to people, then usually the investigations would go really poorly. Alright, the next one's going to be health, which is other people's priorities and values that we actually have to worry about. We have to be considerate over it. And then environment. Just like when you talk to people, you have to have knowledge of what's going on. The knowledge of your surroundings, you have to know what type of culture that you're walking into, their religion that they practice, their values, their traditions. And I believe that if you're not able to do that, then you're not going to be able to talk to them or have any kind of positive values towards you or them. Easy enough too, if you don't know your surroundings, then you can actually offend someone and you can get the place sued. Just because you're making fun of some sort of religion and they happen to be practicing that religion. That would be a bad day for everybody. Alright. Next is going to be the future of nursing. Alright. Well, I think nursing's always going to be around. Nursing's never going to leave. And wherever you go, nurses are always hiring. Every time I look at new careers or new jobs that I apply for, the number one thing, especially in USA Jobs, is going to be physicians and nurses. They're always in the market. And it's not just here, but the demand is high all around the world. So the future of nursing, I believe, is always going to be around. And I think the challenges I'll face is stereotyping. I know when I read books or if I talk to people, normally when someone says a nurse, you actually think of a female. And obviously, I'm not a female, so that's going to be a stereotype that people are going to look at me weird about. And then they're automatically going to assume what's wrong with them just by looking at them. I know I'm a victim of it because I do it to my mother all the time or her husband when I'm feeling sort of sick, that I would call them and give them my symptoms to see if they knew what they were, but 9 times out of 10 they don't know because they haven't seen me. And another challenge is finding a job. That's going to be where to find a job, and would I move back to my hometown for a job, since I'm not originally from Fayetteville. Now, I don't think that's going to be too hard for me, since my plan is to go back active duty. I just have to meet the requirements to go back in, and hopefully I do. Alright, professional development. Pretty much, my short-term goals are going to be, I want to attain my BSN, and I want to start my career in the medical field. And then, not just stop at my BSN, but I also want to continue my education and try to go for my master's degree. Now, my long-term is to eventually go back active duty. One of the requirements to go back active is if I don't do ROTC, I have to have 2 years experience in the medical field before they would actually consider taking me. And then also when I graduate with my master's, I want to be able to attain my PhD as well. Okay, so a recap is going to be, it was about who I am, which we covered, and also a recap about nursing. And the recap about nursing is going to be the definition of nursing, the existence, the assumptions, the domain definitions, the future of nursing, the challenges I'll face, professional development, and that will be all of them. Now, does anyone have any other questions? Thank you.